Testing. Testing, testing. Testing, testing, 1, 2, test, 1, 2, 3.
That's what we say.
We have 6 members. Subcommittee is in order. Thank you all for being here. Today we meet to mark up a total of 7 pieces of pending legislation, all of which were discussed during our legislative hearing on June 13th. In accordance with the committee rules, the subcommittee has reached out to the Congressional Budget Office seeking informal cost estimates for each of the bills on today's agenda. It is my intention to forward all of these bills to the full committee this afternoon with the understanding that all estimated costs will be offset in accordance with the House rules during a full future committee markup or prior to consideration on the House floor. In the interest of time, I will refrain from any further opening comments and yield to Ranking Member Brownlee.
Well, I will just say thank you, Chairman Dunn, for holding this timely markup, and I appreciate the opportunity to cure the concerns of various stakeholders that were expressed at the recent legislative hearing. While some bills on the agenda seem to address the concerns of our stakeholders, I fear that other bills still need a little bit more work, but I hope to continue to work in a bipartisan manner as we move towards a full committee markup on these measures. I look forward to today's proceedings, and I yield back.
Thank you very much, Ranking Member Brownlee. I now call up H.R. 2787, the Vet MD Act. The clerk shall report.
H.R. 2787, to establish in the Department of Veterans Affairs a pilot program instituting a clinical observation program.
The bill was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. The bill is now open for amendment at any point. Who seeks recognition for the purpose of offering an amendment?
Mr. Chairman, I have an amendment at the desk.
You are
I have an
recognized.
amendment in the nature of a substitute at the desk.
The clerk shall report.
An amendment in the nature of a substitute to H.R. 2787, offered by Mr. Takano. Strike all the enacting clause and insert the following.
I ask unanimous consent that further reading of Representative Takano's amendment in the nature of a substitute be dispensed with. Hearing no objection, it is so ordered. I now recognize Representative Takano for 5 minutes to discuss his amendment in the nature of a substitute.
Thank you, Mr. Chairman. I'd be happy to offer the amendment. I'm happy to offer the amendment in the nature of a substitute to H.R. 2787 to make technical changes and rename the bill the Vet Health Professionals Act. H.R. 2787 was introduced by my friend and colleague from Ohio, Congresswoman Marcy Kaptur. The bill will help fill our nation's health workforce shortage and build a pipeline of health care providers with veteran-specific experience. And one of the key factors medical schools look for in applicants is clinical observation experience. But opportunities for undergraduate students to gain clinical observation experience is limited. If we're to meet the nation's and veterans' need for health care providers, we must look to all steps of the medical education process to build a diverse pipeline of students. Expanding access to clinical observation is one of those key steps. The bill creates a 3-year pilot program at no fewer than 5 VA medical centers to provide undergraduate students clinical observation experience. It also requires the Secretary to submit a report to Congress on the number and demographics of all applicants, those accepted to participate, and those who completed the program. Lastly, the bill requires the VA to share the results of a reflection survey to assess the experience of the student participants. My amendment in nature substitute makes changes to the bill that, to ensure that it's more inclusive and that it creates opportunities for students across the continuum of care. It changes the intent of the bill to allow for observation not only of not only medical doctors, but other health professionals as well. I understand that Chairman Dunn will be offering an additional amendment that strikes language in the bill encouraging to the VA to take into account staffing shortages the VA faces. As originally drafted, the VA was concerned this would place a burden on understaffed facilities. However, I hope that moving forward, we can continue to work with Representative Kaptur's office to find a solution that isn't burdensome to the VA, but that also gives students a glimpse into healthcare professions that are most in demand. I applaud Congresswoman Kaptur for her hard work on this bill. I urge my colleagues to support the ENS, and I yield back.
Thank you, Representative Takano. Do any members have any comments? I have an amendment to the amendment in the nature of a substitute at the desk. The clerk shall report.
Amendment to the amendment in the nature of a substitute to H.R. 2787, offered by Mr. Dunn.
I ask unanimous consent that further reading of my amendment to the amendment in the nature of a substitute be dispensed with. Hearing no objection, so ordered. I will say my amendment has been discussed with Representative Takano, and it would expand the focus of this pilot to include all health professionals, not just physicians. Our hearing last week on staffing shortages showed the VA is in need of a large variety of providers, not just physicians, to treat veteran patients. For example, there are large shortages of psychologists and physical therapists in VA medical facilities across the country. Neither of those careers require a medical degree. We felt expanding the scope of this pilot would allow a broader range of students with a broader range of interests the chance to learn more about the VA healthcare system and the opportunities that exist there for a long and meaningful career in service to our nation's veterans. My amendment would also remove two provisions from the underlying bill. One of these provisions would authorize the VA to provide clinical observation sessions with physicians employed in occupations with large staffing shortages. While that is well intended, it could result in those providers whose services are most in demand and who are most unlikely to have other providers to fill in for them having to take time away from patient care, which could reduce access and increase wait times for veteran patients. The other provision would require VA to establish procedures to follow up with student observers to ascertain whether or not they were accepted into medical school. We feel that would be a time-consuming task for the VA to accomplish, given that student observers are undergraduates who may not apply to medical school for several years after participating in the pilot, if at all. What's more, medical school acceptance is not an appropriate measure of success for a pilot that is being expanded to include health professions that do not require medical school admission. Do any members wish to comment on my amendment to the amendment? Since no further amendments were timely filed, the question now occurs on my amendment to the amendment in the nature of substitute to H.R. 2787. All those in favor say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it, and the amendment to the amendment in the nature of a substitute to H.R. 2787 is agreed to. The question now occurs on Representative Takano's amendment in the nature of a substitute to H.R. 2787 as amended. All those in favor say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it, and the amendment in the nature of a substitute to H.R. 2787 as amended is agreed to. I now recognize Ranking Member Brownlee for a motion to forward H.R. 2787 as amended.
Mr. Chairman, I move that H.R. 2787 as amended be reported favorably to the full committee.
All those in favor say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it. The motion is agreed to, and H.R. 2787 as amended is forwarded favorably to the full committee. Thank you very much, Ranking Member Brownlee. We will now take up H.R. 3696, the Wounded Warrior Workforce Enhancement Act. The clerk shall report.
H.R. 3696, to require the Secretary of Veterans Affairs to award grants to establish or expand upon master's degree programs in orthotics.
The bill was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. The bill is now open for amendment at any point. Who seeks recognition for the purpose of offering an amendment?
Mr. Chairman, I have an amendment in the nature of a substitute at the desk.
The clerk shall report.
Amendment in nature of a substitute to H.R. 3696, offered by Mr. Correa. Strike all after the enacting clause. And
I ask unanimous consent that further reading of Representative Correa's amendment in the nature of a substitute be dispensed with. Hearing no objection, so ordered. I now recognize Representative Correa for 5 minutes to discuss his amendment in the nature of a substitute.
Thank you, Mr. Chairman. I offer an amendment in the nature of a substitute amendment to H.R. 3696. This was originally presented by Congressman Cartwright. The Department of Veterans Affairs already has 5 centers of excellence in prosthetic research associated with academic affiliates. My amendment removes the language in the underlying bill and thus requires the VA to award a grant to a non-VA institution to develop a center of excellence in orthodontic and prosthetic education. As amended, the legislation will still require VA to award federal grants to eligible universities for the establishment of and expansion of a master's degree program in orthodontic orthotics and prosthetics, with priority for eligible universities with an affiliation with a VA or DoD medical center. Mr. Chairman, I urge adoption of the amendment.
Thank you very much, Representative Correa. I will be supporting this amendment in the nature of a substitute. Do any members wish to comment? Since no other amendments were timely filed, the question now occurs on Representative Correa's amendment in the nature of a substitute to H.R. 3696. All in favor say aye.
Aye.
All those opposed say no. In the opinion of the chair, the ayes have it, and the amendment in the nature of a substitute to H.R. 3696 is agreed to. I now recognize Ranking Member Brownlee for a motion to forward H.R. 3696 as amended.
I move that H.R. 3696 as amended be reported favorably to the full committee.
All those in favor say aye.
Aye.
Opposed? Say no. In the opinion of the chair, the ayes have it. The motion is agreed to, and H.R. 3696 as amended is forwarded favorably to the full committee. Thank you very much, Ranking Member Brownlee. Now, taking up H.R. 5693, the Long-Term Care Veterans Choice Act. The clerk shall report.
H.R. 5693 to amend Title 38 United States Code to authorize Secretary of Veterans Affairs to enter into contract.
Bill was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. The bill is now open for amendment at any point. Who seeks recognition for the purpose of offering an amendment?
Mr. Chairman, I have an amendment in the nature of a substitute at the desk.
The clerk shall report.
An amendment in the nature of a substitute to H.R. 5693 offered by Mr. Higgins of Louisiana. Strike all after the enacting clause and insert the following.
I ask unanimous consent that the further reading of Representative Higgins' amendment in the nature of a substitute be dispensed with. Hearing no objections, so ordered. I now recognize Representative Higgins for 5 minutes to discuss his amendment.
Thank you, Mr. Chairman. My amendment in the nature of a substitute to H.R. 5693, the Long-Term Care Veterans Choice Act, clarifies that over the course of the 3-year pilot program, the VA is able to cover the cost of care in a medical foster home for up to 900 veterans per day who would be otherwise eligible for nursing home care through the VA. Medical foster homes are private homes in which a caregiver provides services to a small group of individuals who are unable to live without day-to-day assistance and are an alternative to nursing homes for those who require nursing home care but prefer a non-institutional setting with fewer residents. For many young veterans in need of round-the-clock care, MFHs can provide a more age-appropriate independent setting than traditional nursing homes. The VA has operated this medical foster home initiative for nearly 20 years, and it currently oversees more than 700 licensed caregivers caring for nearly 1,000 veterans in 42 states. Unfortunately, while the VA will cover the cost of home-based primary care for eligible veterans living in medical foster homes, the VA does not cover the cost of MFH living arrangements for veterans, although they're otherwise eligible for nursing home care through the VA. These veterans instead pay an average of $1,500 to $3,000 per month for medical foster home care out of their own pocket or through private insurance, a significantly lower cost than the nearly $7,000 a VA would otherwise pay per patient in a state VA nursing home. While VA nursing homes are an invaluable resource for many, there is no one-size-fits-all standard of care for veterans. Veterans should be afforded flexibility to use the benefits they've righteously earned in a manner that best suits their individual needs. H.R. 5693 gives much-needed choice and personal dignity back to these brave men and women who have selflessly sacrificed for our nation. H.R. 5693 has the support of multiple veteran service organizations and the VA. This month, the VA testified in support of this legislation as a net win for American veterans and America that will likely result in cost savings when compared to nursing home care. I urge all of my colleagues to join me in supporting this legislation, and I yield back the balance of my time.
Thank you, Captain Higgins. I will be supporting this amendment in the nature of a substitute. Do any other members wish to comment? Representative Ranking Member Brownlee, you are recognized.
Thank you, Mr. Chairman. I'd just like to thank Mr. Higgins for his work on this legislation, and I think it's a great idea, and I think medical foster homes will prove an incredible opportunity for our veterans who need long-term care, and I'm proud to co-sponsor the legislation with you, and thank you for your work, and Mr. Chairman, thank you, and I yield back.
Thank you, Ranking Member Brownlee. Any other members wish to comment?
Mr. Chairman.
Representative Higgins, you're recognized for 5 minutes.
Thank you, Madam Ranking Member.
Thank you, Captain Higgins. Since no other amendments were timely filed, the question now occurs on Representative Higgins' amendment in the nature of a substitute to H.R. 5693. All those in favor say aye. Aye. All those opposed, no. In the opinion of the chair, the ayes have it, and the amendment in the nature of a substitute to H.R. 5693 is agreed to. I now recognize Ranking Member Brownlee for a motion to forward H.R. 5693 as amended.
Mr. Chairman, I move that H.R. 5693 as amended be reported favorably to the full committee.
All those in favor say aye. Aye. Those opposed say no. In the opinion of the chair, the ayes have it. The motion is agreed to, and H.R. 5693 as amended is forwarded favorably to the full committee. My congratulations to both Ranking Member and Representative Higgins. We will now call up H.R. 5938, the Veterans Serving Veterans Act of 2018. The clerk shall report.
H.R. 5938 to amend the VA Choice and Equality Employment Act to direct the Secretary of Veterans Affairs to establish a vacancy and recruitment database to
The bill was
facilitate-
circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. The bill is now open for amendment at any point. Who seeks recognition for the purpose of offering an amendment?
Mr. Chairman, I have an amendment in the nature of a substitute of H.R. 5938 at the desk.
The clerk shall report.
Amendment in the nature of a substitute to H.R. 5938 offered by Ms. Gonzalez Colon of Puerto Rico. Strike
I
all.
ask unanimous consent that further reading of Representative Gonzalez Colon's amendment in the nature of a substitute be dispensed with. Hearing no objection, so ordered. I now recognize Representative Gonzalez Colon for 5 minutes to discuss her amendment in the nature of a substitute.
Thank you, Mr. Chairman, Dunn, and Ranking Member Browley, and the rest of the members of the subcommittee for including the amendment in the nature of a substitute as part of the agenda of today's subcommittee markup. As you are aware, this bill seeks to further close the gap between the Department of Veteran Affairs and the Department of Defense by facilitating the employment of applicable service members to vacant positions within the Department, the VA. This will also be achieved mainly through a searchable employment database that will assist in it with identifying departing service members that have military occupation skills that match qualifications of current vacancies within the VA. Upon identifying these factors, the departing service member could potentially be matched with an open position in the Veterans Affairs Administration. This will help him or her in the process of transitioning to civilian life and will help the VA by mitigating current staffing shortages. Mr. Chairman and members, my amendment in the nature of a substitute implements input provided from the VA and the VSOs during the last subcommittee legislative hearing and provides additional technical changes for greater clarity. First, it clarifies that the expedited hiring procedure will be made without regard to the provisions of Chapter I of Chapter 33 of Title V of the United States Code. The provisions contained under this subchapter provide statutory language for the hiring process of civilian positions. Obviating this provision will allow direct hiring procedures to take place and significantly shorten the time period between identifying a soon-to-be departed service member and hiring him or her for a currently vacant position within the VA. Second, my amendment in the nature of the substitute partly defines a qualified member of the armed services for the purpose of the database as one who elects to be listed. This essentially allows the service member to opt in the database rather than opting out, as the original text of the bill indicated. The last amendment, the last part of the amendment would allow the Secretary of Veteran Affairs to submit an implementation plan to the Committee on Veterans Affairs of the House and the Senate no later than 180 days after the date of the enactment of this act. This will also provide ample time to the VA to devise an execution plan that will lead to the creation of the searchable database and delineate a collaboration with the Department of Defense for this endeavor. As previously mentioned, the content of this amendment, in the nature of a substitute, observes the comments made by the Department of Veteran Affairs and the Veteran Service Organizations. The input of both is essential to the effectiveness of this bill, and I appreciate them taking the time to communicate their concerns and look forward to continue working together to move forward with this legislation. With that, I urge my colleagues to join me in supporting this legislation, and I yield back the balance of my time.
Thank you, Representative Gonzalez-Colon. I will be supporting this amendment in the nature of a substitute. Do any other members wish to comment? Since no other amendments were timely filed, the question now occurs on Representative Gonzalez-Colon's amendment in the nature of a substitute to H.R. 5938. All those in favor say aye. Aye. Those opposed say no. In the opinion of the chair, the ayes have it, and the amendment in the nature of a substitute to H.R. 5938 is agreed to. I now recognize Ranking Member Brownlee for a motion to forward H.R. 5938 as amended.
I move that H.R. 5938, as amended, be reported favorably to the full committee.
All those in favor say aye. Aye. Those opposed say no. In the opinion of the chair, the ayes have it. The motion is agreed to, and H.R. 5938, as amended, is forwarded favorably to the full committee. Thank you, and congratulations again. Votes have been called. However, I think we can pretty easily get through one more bill before we recess for votes. I would ask you to please try to make it back after the votes. We need a quorum to mark up the last two bills, so show some pity on your chairman. Thank you. Wow. H.R. 6066, I now call up H.R. 6066. The clerk shall report.
H.R. 6066 to amend Title 38 United States Code to improve the productivity of the management of the Department of Veterans Affairs, Healthcare, and
The
further.
bill was circulated in advance pursuant to committee rules without objection. The first reading is dispensed with. The bill is now open for amendment at any point, and I have an amendment in the nature of a substitute at the desk, and the clerk shall report.
Amendment in the nature of a substitute to H.R. 6066, offered by Mr. Dunn of Florida. Strike all after the enacting clause and insert the following.
I ask unanimous consent that further reading of my amendment in the nature of a substitute be dispensed with. Hearing no objections, so ordered. My amendment in the nature of a substitute is based on feedback received from veteran service organizations during our legislative hearing earlier this month and on technical assistance received from the Department of Veterans Affairs. It would require VA to ensure that all providers who fall below minimum thresholds within their clinical area of responsibility attend training on clinical procedure coding. It would also require that in establishing performance standards and remediation plans to address clinical productivity and efficiency, VA incorporate other productivity measures and models to consider non-clinical duties and factors that impede productivity. We know that some VA providers perform important and time-consuming duties, like training residents and conducting research. We also know that some VA providers are constrained by productivity limiting factors that are outside of their control, like insufficient support staff and inadequate exam room space. Taking those duties and factors into account and having the flexibility to integrate other measures and models where appropriate will ensure that the full extent of a provider's work is captured. I believe that this will result in better, more useful data. My amendment in the nature of a substitute would also require the VA to develop comprehensive staffing models for all VA medical centers. During last week's hearing on hiring, we heard loud and clear from the VA Inspector General that comprehensive staffing models are needed to keep to help address VA staffing shortages at VA medical facilities across the country. The IG has been recommending VA develop such models for years, but instead the VA has been developing models for select specialties only. With persistent staffing shortages like those seen across the VA, this is no longer an acceptable course of action. I want to stress that this bill is not intended to be punitive or set up biased comparisons between the VA and the private sector. We all know that the VA has a unique mission and faces unique challenges. However, if we don't start capturing critical information about staffing, productivity, and efficiency, we will never be able to improve VA in the way our veterans, our employees, and our taxpayers deserve. Do any members wish to comment? Please, Representative Castor, you're recognized for 5 minutes.
Thank you, Mr. Chairman. I wanted to speak on the amendment to H.R. 6066. Unfortunately, I must voice my opposition to the amendment and the underlying bill by Dr. Wenstrup. While I appreciate the intent of the legislation, the chosen metrics, I feel, still fail to take into account the kind of care the VA provides, care that routinely ranks the VA at the top of veterans' patient satisfaction surveys conducted by VSOs like the VFW. Relative value units, or RVUs, may be a useful metric, but it remains unclear if RVUs will account for VA's status as a teaching institution. 2 weeks ago, members of this committee attended a roundtable to resolve some of the longstanding provider shortage issues at VA. One of the issues presented was the inability for current metrics to appropriately quantify and value the time taken by VA physicians to train the next generation of physicians. I fear this bill will degrade VA's greatest asset. Additionally, VA physicians and medical providers must take additional time per patient than in the private sector because of the prevalence of comorbidities and the unique cultural circumstances that improve the delivery of care. However, I would like to extend my gratitude to you for working with my colleagues to try to resolve the issues we presented. While I still cannot support the bill in its current form, I will continue to work with you. Thank you. I yield back.
Thank you for your input, Representative Castor. Since no other amendments were timely filed, the question now occurs on my amendment in the nature of a substitute to H.R. 6066. All those in favor say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it, and the amendment in the nature of a substitute to H.R. 6066 is agreed to. I will now recognize the Ranking Member Brownlee for a motion to forward H.R. 6066 as amended.
I move that H.R. 6066, as amended, be reported favorably to the full committee.
All those in favor say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it. The motion is agreed to, and H.R. 6066, as amended, is forwarded favorably to the full committee. Once again, congratulations to you on that bill. I am now going to call a recess for votes. We have 2 more bills that we need to mark up, and I would greatly appreciate your return after votes. The subcommittee stands in recess. Let the record reflect this. This is an excellent committee that came right back from votes. You know, very, very responsible. I'd be proud to have any of you as my representative. We now have 6 members, and the subcommittee is in order. Session. We're going to take up H.R. 5864, the VA Help Act. The clerk shall report.
H.R. 5864, to direct the Secretary of Veterans Affairs to establish qualifications for the human resources positions within the Veterans Health Administration of the Department of Veterans.
Bill was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. The bill is now open for amendment. Since no amendments were timely filed, do any members wish to comment on H.R. 5864? I now recognize Ranking Member Bradley for a motion to forward H.R. 5864.
Mr. Chairman, I move that H.R. 5864 as amended be reported favorably to the full committee.
All those in favor say aye. Aye. Those opposed, no. In the opinion of the chair, the ayes have it. The motion is agreed to, and H.R. 5864 is forwarded favorably to the full committee. Well done, Ranking Member Brownlee. I now call up H.R. 5974, the VA Cost Savings Act. The clerk shall report.
H.R. 5974, to direct the Secretary of Veterans Affairs to use on-site regulated medical waste treatment systems at certain Department of Veterans Affairs facilities and for other purposes.
The bill was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. The bill is now open for amendment at any point. Who seeks recognition for the purpose of offering an amendment?
Mr. Chairman, I have an amendment to H.R. 5974 at the desk.
The clerk shall report.
Amendment to H.R. 5974, offered by Ms. Radowagen of American Samoa. Page 3, line 1 in the subsection heading for subsection D, insert blanket before purchase.
I ask unanimous consent that further reading of the amendment be dispensed with. Hearing no objection so ordered, I now recognize Representative Radowagen of American Samoa for 5 minutes to discuss her amendment.
Thank you, Mr. Chairman. My amendment to H.R. 5974 would give the Department of Veterans Affairs the flexibility to continue delivering on-site medical waste management via a contract, agreement, or other arrangement once the existing blanket purchase agreement that governs on-site medical waste management today expires or is replaced. This amendment was developed based on technical assistance from VA, and I hope that all of my colleagues join me in supporting it. I yield back the balance of my time.
Thank you, Representative Radowagen. I can imagine that this has immediate bearing in your district, and I will be supporting this amendment. Do any other members wish to comment?
Mr. Chairman.
Representative Higgins, Louisiana, you're recognized.
I have reservations regarding H.R. 5974, the underlying bill. I'm going to be withholding my support for the amendment, therefore, and I just respectfully wanted to state that my concerns reflect overburdening VA facilities that are already taxed and perhaps interfering with local commerce and jobs and the locally impacted economic impact. So I'll be withholding my support, but I do so respectfully.
Thank you, Representative Higgins. Do any other members wish to comment? Since no other amendments were timely filed, the question now occurs on Representative Radowagen's amendment to H.R. 5974. All those in favor say aye. Aye. All those opposed? No. In the opinion of the chair, the ayes have it. The amendment to H.R. 5974 is agreed to. I now recognize the Ranking Member Brownlee for a motion to report H.R. 5974 as amended.
Mr. Chairman, I move that H.R. 5974 as amended be reported favorably to the full committee.
All those in favor say aye. Aye. All those opposed, no. In the opinion of the chair, the ayes have it. The motion is agreed to, and H.R. 5974, as amended, is forwarded favorably to the full committee. Thank you, Representative Brownlee. In summary, the subcommittee has voted to forward the following 7 bills favorably to the full committee: H.R. 2787 as amended, H.R. 3696 as amended, H.R. 5693 as amended, H.R. 5938 as amended, H.R. 6066 as amended, H.R. 5864, and H.R. 5974 as amended. My sincere thanks to all the members of my fellow subcommittee members, Ranking Member Brownlee in particular, and the sponsors of all the bills and the amendments that were considered here today. I think that this is, once again, gives us reason to reflect on the work ethic of the Veterans Administration Committee, the collegiality and the bipartisanship that it has demonstrated throughout the 115th Congress. Without objection, the subcommittee staff is authorized to make any technical, clerical, or conforming amendments as may be necessary to bills to favorably forward to the full committee today. Hearing no objection, so ordered. This meeting is now adjourned. Thank you for your timely return from votes.
We're done with votes.
Yeah, well, yes, but your timely return.
Yes,
So that was,
yes, yes.
makes the wheels of legislative commerce